Great. So today's webinar, titled The State of Continuous Enrollment Unwinding and the Impact of Churn, is brought to you by Linda Roman, who is the Senior Vice President of Strategic Account Management for Centauri Health Solutions. Centauri Health Solutions has been a longtime MHPA Bronze member and supporter of MHPA and our member health plans. So we appreciate Linda and her team putting together today's session and sharing their thoughts with us. So with that, I'll go ahead and turn things over to Linda.
Thank you so much, Eric. We appreciate the opportunity to have a conversation today about the experience that we've all been undertaking over the past year in 2023, and just thinking a little bit about how that may inform what we see in the future in 2024 and beyond. Of course, let me just make sure I can get my computer to move forward here. Okay, so today we're going to talk a little bit about the current state of the unwinding and the redetermination process that's been underway since about March or April, the impact on Medicaid churn and what some are calling the boomerang effect that may occur in 2024, what some of what we've experienced this year may teach us about ongoing Medicaid redeterminations, and just how that may inform the path forward to a post pandemic redetermination, or what churn may look like into the future. So I think so one of the things I would just say, just to be somewhat transparent and a bit conversational, is, of course, we anticipated this unwinding process for almost a year before it actually arrived. And then once it actually arrived, it's been a little bit rocky along the way. And so there were some things that we thought we would know by now that maybe we don't still know for sure. And frankly, when we first thought about doing this webinar at this time, we thought we would have maybe a more conclusive picture. But regardless, I think there's a lot of good information for us to talk about and for us to think in terms of how it might inform what we do long term. So let's just start with kind of the state of the union, or the state of play as it relates to the unwinding process. Now, part of this slide is a slide I used in an early presentation last year, where we said, what do we think is going to happen? And this black writing here is what we presented at that time, you know, what the Urban Institute had predicted in terms of what they thought the unwinding would impact. They thought there would be about 18 million people, 15 to 18 million people lose their Medicaid coverage. Currently, we're at 10.8 million. So we're this far into the process, and we're at 10.8 out of the 15 to 18 million projected. At the time, we thought 3.2 million of those would be children. Currently, we're at about 38% of the disenrollments have been children. And so probably not too far off, but a little bit higher in children than maybe was originally anticipated. So not all states have been reporting the disenrollments by age group, but here in the lower left corner chart, you can see of the states, Kaiser Family Foundation put together a report that reported kind of the distribution between adults and children. And you can see these states that did report by age breakdown, kind of where the children and adult distribution came in. And in some states, it was substantially higher than 38%. But then obviously, you know, California, Massachusetts, it's somewhat lower than that. And so I think the children's proportion has been a little bit higher than expected. Now, one of the other things that was somewhat anticipated, this is actually just a chart from Health Management Associates analysis that they completed, and pre-pandemic Medicaid was at about 70 71, like 2019. And even at the end of the unwinding process, it's anticipated to still be at 80 million. So still anticipating it ending at a little above what it was at the beginning of the pandemic. So partway through the process, CMS did issue an all hands on deck memo in August 11th. And at that time, they reported that about 45% of renewals had resulted in people being successful in their renewal. About 31% were losing, and that about 24% were still in process at that time in August. CMS really recommended at that time, they were seeing a large proportion of members with losing eligibility due to administrative processes as opposed to being ineligible. And so they really were encouraging the states not to rush the renewal process, to really adopt as many of the waiver strategies and enrollment strategies that they could, that CMS had outlined, and asking the public to aggressively partner with managed care, hospitals, doctors, nurses, everywhere that would come in contact with beneficiaries, to really make this an all hands on deck effort to try and make sure people knew what to do, how to do it, to encourage that they would maintain their eligibility. So even after that time, after August, procedural disenrollments have continued to be an issue. As you can, overall, during the time it started through November, the procedural disenrollments have been about 71%. That's a pretty high proportion. And some states, you know, as you can see on this chart on the lower right-hand side, are even substantially higher than 71%. Doesn't matter, Democrat, Republican state, doesn't matter. There's a high proportion of procedural disenrollments. Now, one thing I did note, however, as you can see, the procedural disenrollments starting in April were very high proportion of the total disenrollments, which at 79%. And over time, it has come down substantially. In November, the procedural disenrollments were 47% of the total. So I would say then it looks like improvements are being made around the procedural. I mean, 47% is still a high proportion of procedural disenrollments, but certainly there have been a lot of progress made over the period of time from, you know, April to November. So look, hopefully those types of disenrollments are coming down. This is another analysis and study that was done by HMA as well. It shows in the bars by state kind of where they are in their disenrollment. The red dot, but the point that they're making here in this analysis is we're still early in the process. We still have many months to go before this is totally complete. And even it may not, like there may even be ramifications after that to take account of. But the point here is that these red dots that I have these little arrows pointed to are where they estimate that those states will end up. Now, as you can see, California looks like still has a long way to go in order to hit that number. I don't know for sure if they will, but it certainly is possible. And many states still have many more enrollments to get through in order to really complete this process and see how it fully impacts at the end of the 14-month time period. So just because they sort of, a state hasn't hit what was anticipated initially, doesn't mean they won't. We're still probably only a little bit about halfway through the process, maybe slightly more. Some states started earlier than others. So while we talk a lot about the numbers and the global numbers, it's important also to think in terms of what's the experience really been like for beneficiaries, for individuals. And so there was an interesting focus group done by the Kaiser Family Foundation, and they have reported on that just recently, I think November 22nd, in which they really took a group of 35 adults across 3 states to determine what's been the actual member experience. And of course, it has varied substantially. The population that they recruited to do the focus group was they currently were managing an array of physical and mental health conditions as well as financial challenges. They felt like their Medicaid had enabled them to access healthcare, mental health, and medications for themselves and or their children. And they felt like Medicaid coverage really helped them stay healthy so that they could continue to work. There was a mix of adults by gender, race, ethnicity, age, length of time they'd been enrolled in Medicaid. And they did in fact ensure that they had some members who had lost their coverage as well to be a part of the focus groups. And so, somewhat not surprising, those people who were successful in renewing found that the process was fairly quick and easy. And often they were able to complete their process online in a fairly efficient and easy process. But many others reported having quite a few barriers, both communication barriers as well as time frame barriers, in the sense that it would take them multiple weeks and months in order to either reach someone at the local agency or get paperwork submitted, oftentimes losing their coverage while they were waiting for that process to get complete. Those that got disenrolled felt like that they had a lot of communication problems in being able to access the right information. And oftentimes people learned of their disenrollment when they needed to access services for some kind, either when they were trying to renew prescriptions or when they were trying to seek medical care. Some of the people who lost coverage did in fact obtain coverage through the marketplace or through an employer sponsored plan, and some have not found coverage. And so obviously for those who have not found alternative coverage, they now have an inability to maintain their physical and mental health through this program. From the focus group, there were kind of 3 conclusions that were drawn from the discussions with the beneficiary. And, you know, the kind of obvious ones is to provide multiple ways for people to complete their renewals, to communicate early, clearly, and using more than one mode, not just mail, not just phone calls. And then also to offer access to support centers where people can access help and get questions answered. And so those were kind of the summary conclusions from the focus groups that came out of the conversations with the individuals. So just a little bit of summary about kind of where we are is that of the members who have lost their coverage, about 41% have in fact obtained alternative coverage from another source. About 16% are uninsured, and about another 26% have been uninsured for a full year, and some of the 16% and the 17% have had a lapse in coverage, but has gotten new coverage. Many in the industry think that, in fact, maybe 40% of those that have lost coverage and not obtained alternative coverage will in fact re-enter Medicaid and CHIP at some point during the next year. But the key will be finding them, getting them the coverage they need, and then being able to get clearly through the process. Clearly, there's a mix of disenrollments, some who have qualified for employer coverage, some who have in fact gotten marketplace coverage, and those who still may come back to Medicaid, of course. So one of the things I would say is Centauri, our organization, has been working in this space. Eligibility and enrollment's kind of one of our core competencies in a variety of areas. And so we did have some experience in Medicaid applications prior to this. And so with many organizations that we work with, we did partner to do some outreach to some of those members that were going to be experiencing these disenrollments. And so over the course of the last few months, we have done outreach to over 1.5 million members. One of the things I would say, or not one of the things, but kind of a variety of things I would say about the process is there have been significant state delays in, every state has kind of had a little bit of a different approach, starting at different times, had different kinds of issues that have popped up. It's been a little bit of a start and stop kind of process from the beginning. Sometimes there have been data file issues between the states and the plans, and then getting that information into our hands so that we could do the proper outreach. Some of the states, in fact, as CMS issued some of their guidance, have stopped and changed processes midstream. And so in some of those changes, there's been a focus toward doing a little bit more education of members, making sure members knew exactly where to go and how to get the help they needed to re-enroll if they continued to be eligible. As a part of the process, we typically would find out whether or not the member had gotten their paperwork, whether they had submitted for re-enrollment, and if they hadn't, if they might likely still be eligible, and then offering them alternatives like a marketplace option if they were not. We ended up, probably the ending part of this process is that we ended up helping probably about 7% of the people in the mix submit applications, which when you think about the historical churn is probably somewhat in line. Churn, according to MacPac from years gone by, has been around 6 to 10%. And so reaching about 7% of these members and doing those submissions is probably not too far off the mark of what we might have expected. Our response rate was about 30%, but clearly a lot of those members, after we reached them, we were able to confirm that they had resubmitted their application, answered questions for them, and things like that. And so throughout the process, we have, in fact, accepted about 20,000 members into the process for getting them some support, administrative support for submitting their renewal applications. Over 11,000 of those cases have already been submitted. We're still in the process of submitting almost 5,000 of those cases, and then almost 5,000 have already been submitted. As you can see here, kind of across the months down here in the lower right hand is kind of how the process has grown, which kind of goes back to the point that HMA made that we're still early in the process. So as you can see, as states have come on, and then the volumes overall have gone up. So the one other thing I would say about the submission activity is, while we somewhat at the beginning of this process anticipated that a lot of our submissions would be done online and really made preparation for that, as it turns out, actually some of the comments that some of the beneficiaries made I remember one beneficiary made the comment that if you don't get into the queue by the first, 15 or 20 for the day, you may as well hang up and call back the next day because you're going to be on hold for over 2 hours. And so there have been states where that has been the case, where, just trying to get access to the online capability or to an individual at the state or the county has been really problematic. As a result, we ended up converting a lot of our submissions to paper. As you can see, nearly 2/3 of our submissions have been by paper as a result, in order to get people into the process and through the process. And so that was something that was surprising to us during the process. We do anticipate that as the process nears the ending, that the online processes will probably go back to being much more viable. But we don't know that for a fact. That's just what we would anticipate. So if we can talk a little bit about, so the year has been a rocky year. We've learned a lot of things throughout the process. More to learn, I would expect, between now and the end of the process. If we think about churn historically, we know from some of the MACPAC data from prior to the pandemic, this is a picture of that churn. Churn is defined as a short-term break in coverage where a beneficiary may be disenrolled from the program and then re-enrolled shortly thereafter. And so this chart here shows that pre-pandemic, that 10.3 was the average percentage of enrollees who did churn throughout the year. And you can see of those who churned at 3 months, had a 3-month gap, it was about 4%. Those that had a 6-month gap, it was about 7%. And those that had a 9-month gap, 9%. And those that had a full year were over that. So if we think about churn in that way, there certainly are some learnings that we had during the pandemic, and as a result of some of the state policy that could impact churn long term. And so if you think about a couple of the key things has to do with the auto re-enrollments. And so one of these policy items here, this particular chart came from the historical MACPAC issue brief that was issued in October of 2021, where it really did talk about the correlation between state policy and the impact on churn. And so for those states that had mid-year data checks, they had higher rates of churns. For states with 12-month continuous eligibility for CHIP, they had lower rates of churn for children. And for those states who used auto renewals, there was typically a little bit a difference in churn. And so you can see from this chart, for children enrolled in eligibility, if there was less than 25% had auto renewals, then the churn was higher. And so you can see from the chart kind of how churn was affected by these different policies. And so it still ranged, depending upon the age category or the benefit category, from 4%. Well, there was this group here, those with disabled and aged, that were the lowest, of course. But you can see for these categories that are typically in Medicaid, it still ranged from 4 as high as 12% for these categories if they did not have auto enrollment. So a couple of the key findings and the things that could impact churn going forward is the continuous eligibility. So as a part of the unwinding and the, I believe it was the change to the Build Back Better reconciliation bill, it did require that plans implement, as of January 1st of this coming year, to implement continuous enrollment for children in Medicaid and CHIP. And so currently, as of sorry about that, as of now, here are the states that have the continuous enrollment here in the yes column, and no in the no column, and those that don't have a separate CHIP plan, that their Medicaid is in CHIP. So you can see that this can have an impact on the children, because I think if we looked at this category here, children did have fairly high rates, and that continuous eligibility certainly may impact lowering their churn rate. So we think that may have a significant impact on churn for children. The other policy issue that we think is significant is that the ex parte renewal process, or the auto renewals, during the public health emergency, many states did take advantage of promoting more ex parte renewal process. And 26 states had improved system rules during this, that they put in place during the pandemic. There were, I think almost all states had some type of waiver. There were over 394 waivers, as a matter of fact, relating to the flexibilities that the legislation provided during the public health emergency unwinding. And so we'll speak a little bit more to that in just a minute. But so what MACPAC did was sanctioned a roundtable of state and federal agencies with Mathematica, where they did really a pretty deep dive into how to improve the ability for use of ex parte renewals. And so they really went through all of the ways in which now during this process and setting up this process, the efforts that were being made to make this run more smoothly. Overall, everyone agreed that improving the ex parte process was an important goal, but that there were also a number of factors that made it pretty complicated. Now, here are the various sources that the ex parte renewals can use to help them do auto renewals. Some of these sources have more current information than others. Various states have more access than others. And so there was a lot of discussion about how to make the process more available across the board. And so there were some recommendations that the focus group had, one of which was they were asking CMS to consider making some of the unwinding related flexibilities more permanent. And as I said, these flexibilities were provided in Section 1902, and there were over 394 of these waivers. Now, most of these waivers related to enabling the streamlined process for asset verification, providing ex parte renewals for information with zero income was very troublesome in the ex parte process. It was difficult to confirm what did not exist. They wanted to be able to use SNAP eligibility information for ex parte renewals. That was a part of the waiver process they hoped could continue. And then the strategies around updating contact information, and the strategies to reinstate eligible individuals for procedural reasons, where we had all these procedural disenrollments. The group was really asking the agency to consider these continuing waiver guidelines. The other really, I think, really important item that they talked about was to really increase data and process transparency, making like some of this information, the way states have been able to implement them, making those things much more transparent so that everybody didn't have to sort of reinvent the wheel in order to implement them. And so that, I think, is an important point. They asked for more guidance and technical assistance from CMS to make some of these flexibilities and the implementation of them more viable state by state. So while everyone agreed with the recommendations of the focus group and really wanted these things to move forward, they all did come away realizing that there were still clear barriers to really being able to implement this on a widespread basis. There is still a lack of integrated systems across the states. There are some states that within the state, they don't even have access to their SNAP data back and forth. And there are limited IT resources throughout the industry, I think, as we probably all know, that can make that process happen as quickly as everyone maybe would like. And so while everyone agreed that these things would help the process and allow for more of the ex parte renewals, there still were just some of these limitations that were unsure about how quickly those things could come to pass. Clearly, if some of these things could be put in place, it could offer sort of some long-term ability to continue to reduce the churn for some of those categories. I think the most difficult categories, as I looked at the information, were those members who maybe gig work, who don't have consistent income that's reportable in any standard sort of format, and the difficulty in being able to validate something where it doesn't feed into a normal system. So as we somewhat talked about at the outset, so we've gone through this process here. There's been a lot of digging into the process. We're trying to take learnings from what has occurred throughout the year, how we've been able to implement some of the waiver capabilities that have been put in place. But before we sort of jump too far, I just wanted to remind everybody that the process is still ongoing. It probably will continue for another 6 months from now until we're really through the process. And just to remind that there are ways to create collaborative partnerships with health plans and provider groups to outreach to these members, to remind them, to support them in an administrative process, and to use all the possible means available to you to reach members and confirm that they have the benefits that they're entitled to. We did see throughout our process, and from what I'm hearing in the industry as well, the guidance that was given by the FCC early this year did provide for some flexibility around being able to text members about these eligibility renewals. So that was extremely helpful. And while the unwinding is continuing, you do have more flexibility as it relates to re-enrolling members. If they have fallen off, you do have 60 to 120 days to get those re-enrollments in, that a health plan can still assist those members with that process during that time. After the end of the 14-month cycle, those special provisions do go away. And once a member has fallen off, then you don't have the ability to outreach to them. It is important to remember that it's a state-by-state process. The eligibility rules are different state by state, and you have to use all the means that you have available to you, whether that's a paper packet or an online or getting a three-way call set up with the state or county agency, using all the capabilities, all the technical capabilities you have available at your fingertips. And again, once the public health emergency is finalized, then it will go back to the standard rules, unless those waiver provisions are continued, which we don't see any indication that they will be, that once the member is disenrolled. So it is important to get to the member in advance of their termination date so that you can make sure they do get their renewal. So a few things that we learned along the process that were some new learnings for us is what we found to be extremely helpful in getting the highest possible engagement rate was to precede the communication for outbound calling. So for example, we all receive all kinds of what come into our phones as numbers that we don't recognize, and we seldom answer them. Well, our members are the same. And so one of the things we found to be extremely helpful was to be able to text the member ahead of time that who we are, and that we're going to be calling on behalf of whatever health plan, and to let them know the number we would be calling from. When we did so, our engagement rate went up over 10%. And so that was a real significant learning that we had. We also, during the process, were able to engage with members through self-service appointment setting. So by sending either a standard message to the member, either through an audio recording or through text, we gave them access to a self-service portal where they could schedule a specific time that we could call them to provide them help, and then to provide appointment reminders. Those members seem to respond in a much higher way as those who just received outreach without knowing kind of what was coming. Instituting chat functions so that they could ask questions by chat. What we have learned through the process is in the future, we'll do more targeting approach to get to that 9% of the population who really need the help most. And making sure that we assist any children that are in separate programs, separate from CHIP, and that just continue to learn from the results that we see on a regular monthly basis. What we recommend over the course of the next year, because frankly, during the next year, we're going to have the continuation of the unwinding for the first 6 months, and then something that we think is going to somewhat return to a little bit more stable population, although there could be some significant boomerang, meaning some of those members who got disenrolled through the process may still be needing help to get re-enrolled in a plan or in the state's Medicaid. So one of the things that's extremely important is to know your state's short and long-term plan. Make sure that you know what your state is doing about the continuous enrollment for children, making sure you know what your state is doing around ex parte and what sources they're using, knowing if you can still get lists from your state that show when a member's renewal is coming up, and then using either your own or other organizations' analytics capability to identify trends so that you can target appropriately. And using every opportunity you can to maximize the outreach to the right people that really do need this help in order to avoid those gaps in care. Using a multitude of communication modes, mail, calling, texting, chat options, some of the self-service capabilities, and making sure you know where to offer members alternatives. One of the things that we think is important in the process is to look for measurement opportunities. Certainly we measure through, what's the eligibility ratio of those people that we are able to reach? Are we reaching the right people? We also measure the success of a program related to the percentage of members who retain their benefit and the retention of that membership in the plan. We typically see in those situations where we assist certain members, we see sometimes between a 7 and 10% difference between that group of members that we're able to assist and the group of members who don't have any assistance in the retention rate for that population. Actually, we're seeing that grow. Just recently looked at some data where our difference between those we help and those we don't is up as high as 12%. And we're thinking that may continue to rise a bit here in the next few months. And so we do think that toward the end of the unwinding, and once we get past the endpoint, that we'll start to see a bit more stabilization in the population, and more of the members who are in the population will continue to be eligible, versus knowing that a fairly significant proportion are no longer going to be eligible. So we will expect to see a higher proportion of members still be eligible for benefits and therefore need the assistance to retain their benefit.
Linda,
I think, yes.
were you just answering the question that was in the chat?
No, wasn't intending to. What is there a question?
I think you may have, but by finishing up that section. But we had a question: can you address the problem of churn that will be ongoing after the initial unwinding? What should plans do to best prepare for ongoing annual redeterminations?
Right. This is kind of that page. So it is kind of the answer is, number one, know what your state plan is. Know if you can continue to get those lists from members. And then also apply analytics where you can to see what the patterns are of those members who do churn. One of the things that we have looked at in terms of doing analytics is to be careful not to assume something based upon the analytics that you've derived from the period during the pandemic, because the period during the pandemic, we knew we were going to have a higher proportion of ineligibles. And so it'll be important to follow those analytics throughout the year, especially the second half of the year, to see what the status quo is going to look like. I would expect that churn is going to get back to somewhere between 5 and 8%. With some of the things that have been put in place, we should see it be a little lower than to 10 to 12% that we saw pre-pandemic. We've learned a lot of things throughout the process, but the key is, pardon me, to get to those members in that 6 to 8% range so that we can make sure those people don't lose eligibility. And so what I believe the long term is going to be, we're still going to see some of that churn. It'll be a little bit lower, slightly lower than what it was pre-pandemic. That's just my crystal ball guess based on the data and what we learned from the process. But in order to reach those members, it's going to have to be a little bit more laser focused than perhaps it has been in the past, using analytics and every mode of communication available to you, and then tracking that data. Any other questions?
We just had a comment, friendly amendment on the 12-month continuous eligibility for children. CMS has subsequently released additional guidance that premiums are not enforceable during the continuous enrollment period. States may require payment for initial premium or enrollment fee, but once enrolled, a child cannot be disenrolled for non-payment.
Good, thank you.
But no additional, oh wait, one more. How are states alleviating the long call hold times that you mentioned?
Well, I think in some cases they haven't really been alleviating them. It's just as the backlog gets worked, it starts to lessen. that is, you know, part of the reason we've looked at alternative means to submit. But for the beneficiaries, as noted in some of the focus groups, sometimes that meant they lost eligibility for a period of time. They got it back once they got through the process, but it has created some hardship, certainly for some beneficiaries. So I don't know that it's been fully eliminated. It's an ongoing issue that we, the industry, the states, the MCOs, the vendors, are working through, and it's going to be an ongoing problem, I think, until the end of the unwinding. So if there are any other questions, I'm happy to sit tight for a minute. If you have other questions that you want to reach out to, feel free to reach out. I think my email address is linda.roman@centaurihs.com. Happy to answer any questions that may have come up, or provide any sources. I do have some sources, many sources. There's a lot of information. People are trying to keep up with and provide analysis as data is available. And it's been an interesting year, a rocky year. I think we've learned a lot. I think there's more to learn, and I think it will inform kind of where we end up during the summer and late summer, after the full end, and all the states have completed their 14-month unwinding process. So any other questions, Gretchen?
No, not so far.
Okay. I really appreciate your time today. This has been a topic, challenging times for everybody throughout this process. I think everybody has really come together to try and do what they can to help our beneficiaries. And I really appreciate your interest in the topic. I've been sort of living through it this year, and it's really kind of a passion of mine that people who need this coverage maintain their coverage, because it does directly impact their lives in such a significant way. And so I really appreciate your interest in the topic, and thank you so much for joining today.
Is the presentation going to be posted anywhere, Eric?
If people want the presentation, if they will just outreach, we'll be happy to get them a copy.
Yes, and we are recording today's session, which will be available on MHPA's YouTube channel as well. I think that was incredibly well said, Linda. Thank you so much for your insight today. Obviously, it's been, like you said, a very interesting year, but we appreciate you kind of polishing off your crystal ball and kind of giving us a sense of what you think it may look like moving into the future. Like they said, like Linda said, feel free to reach out to her directly, or you can always reach out to me too, and I'd be happy to connect you as well. Andrew, it will be on MHPA's YouTube channel. So if you just go to YouTube and Google Medicaid Health Plans of America, you'll be able to find the recording there. With that, we'll go ahead and close out today's session. Thank you again, Linda, Gretchen, and the entire Centauri team. And thank you to everyone who joined us this afternoon. I hope you found today's session informational and enjoyable, and will join us again in the future. Have a great afternoon, everybody.
Thanks, Eric.